Fantastic. I don't know about you guys, but I'm a little exhausted. I don't think I've slept this week. And I think the most surprising thing to me was how surprised people were by what just happened. And so for this presentation, I've been, a lot of people have been reaching out um, with a bunch of questions. So I'm going to be answering some of those, but I really want to spend as much time as possible really talking about what we can do next, and what this means for patients overall. So I want to thank the Society of Cannabis Clinicians, Realm of Caring, Veterans Initiative 22, amazing partners at Americans for Safe Access. These are not all the organizations we work with, but they're the ones who got back to me in time, in short order. So, things have been moving very quickly this week. And just know that this will be the first of many meetings. This is something that we've been working on at Americans for Safe Access for 23, almost 24 years. And, this presents some challenges, but some opportunities that I hope you leave this presentation at least understanding what is factual, what the sort of timeline looks like, and really own the power of being a medical cannabis patient moving forward. Okay, I am also going to share this presentation and this video with folks. I just need a little bit of time to turn it around. So I would say by tomorrow night, you should have a link to this video and this presentation. And I will also say that I made this presentation and I did not have time to go through it myself. So hopefully it makes sense. And if you've all slept, you might be living in a little bit of a different reality than me. But anyway, welcome. So we're going to, in this presentation, hopefully cover what just happened, what it means for patients, and what we can do. It always looks so simple in an agenda, doesn't it? I'm also, yesterday we had more of a policy briefing that I'm editing and we'll also have up on YouTube for folks, and I'll share that link with you as well. And this is, has more sort of different stakeholder perspectives, and, sort of a deeper dive into some of the expertise around what is happening. Okay, in case I forgot what just happened. Okay, so you guys know, or many of you may know, that the sort of state of things that we're in, which I refer to as the state experiment, started with the Controlled Substance Act, and patients immediately started looking for avenues for access. And there was a federal medical cannabis program for a short period of time that was shut down, and that pushed patients into the states to create um, the current experiments that we're all a part of today. But this plant that means so many things to so many people, well, we operate within the medicine world and maybe the foodstuffs, but it also is can be used for fiber and clothing and plastics, and it's just a pretty remarkable plant. And so we've started seeing some legal definitions about how much THC is in this plant, but at the end of the day, this is one amazing plant. And oh, sorry, that was there. And we've seen this. I mean, nature has other versions of this, right? And I've actually stopped using this slide in presentations because a lot of people don't know that this is the same plant. But you're not just growing one plant, and it's going to produce all of these vegetables over time. People have, or humans have, cultivated different varieties that really, are meant to be harvested at different times and really produce better Brussels sprouts, better cauliflower. But at the end of the day, it's the same plant. And this one doesn't get you high, so no separate regulations. But this fight that we've been fighting as patients, right, has it looks like this. A lot of people just say, oh, there's 40 states that have medical cannabis programs. But when you're in these programs, you know that there are a lot of people that are left out of the state medical cannabis programs. So simply just passing a medical cannabis law doesn't automatically equal um, equal access. And in fact, in order for a patient in a state that has a medical cannabis law to get access, there's a lot of barriers, right? When we pass that medical cannabis law, that's the first step. And so, it's expensive depending on where you work, what you're doing. It may not be an option at all. And so, as we've seen adult use come into the market, we've also seen products that we depended on removed from those shelves. And so, the dispensaries that we fought to serve patients and that states licensed to serve patients, patients are finding that those products like high CBD products were just unavailable. And it's expensive, right? Not everyone can pay out-of-pocket costs for their medication or to travel. And it's not just all Americans, but there's poverty within veterans communities that we know need these medications. We've been hearing all this news about an uptake in medical cannabis use in seniors, but they definitely can afford the doctor's rec or paying out of pocket for their medications. And so while we've been doing our experiment, right, there's another use of the plant, the hemp used for fiber and foodstuffs, has had their own battle. And we have, some of the same laws that have impacted our medicine have also impacted, their ability to produce hemp in the United States. But, this has been a long battle to be able to provide this amazing foodstuffs and, this commodity that we're seeing it being more and more competitive around the globe, especially as we're looking at environmental impacts of like building supplies, paper, all of those great things. And so in 2018, with the Farm Bill, they finally were able to remove themselves from the definition of marijuana that they got thrown together with in the passage of the CSA. And so the Farm Bill, while it removed, it defined hemp and removed it from the CSA, it didn't really describe what are the products, right? And so as they were looking at to regulate these, we wouldn't use the same regulations for building supplies that we would use for food or for medicines. And so I think you guys all know the sort of craziness that has meant for the last 7 years. And so what just happened is within the agricultural appropriations bill, which, a lot of people thought that this was going to get handled in the Farm Bill because it was supposed to be reauthorized in 2023. People just, because of the pressure of attorneys generals and state elected officials and really everyone, this, language that we saw last year in the Farm Bill to define industrial hemp and hemp-derived products ended up in what people have been calling a mini bus. And so in order to get the government back up and operating, Congress passed 3 of the spending bills that they were supposed to pass, and they put them in what they called a mini bus. So that the ag bill, the military and veterans bill, which they also hurt patients in, medical cannabis patients, and then also a legislative bill. And then everything else got put into continuing resolution, which we've seen so many years, where they basically have just extended the current budget to January 30th. And so here's what they did. So they tried to address the issues of dry weight. And you can really see in this language, it's like they were looking at loopholes and saying, how do we avoid this? How do we avoid this? So it's all well and good. That's they say that hemp. This is what hemp is, and it also includes now a definition of industrial hemp. And so that this definition is what you would imagine, right? It's for foodstuffs. It's for things that are manufactured for basically everything but cannabinoids, right? It's a pretty exciting plant again. And for, hemp farmers and people who have been working, um, tirelessly for decades to create these legal protections, they can now move forward with like better investments, right? People who just didn't want to deal with the fiasco they were seeing around the cannabinoid market. So then we get to the cannabinoid products. So the first version, what we saw last year, had this definition, which it's pretty much makes sense, right? It's a hemp-derived cannabinoid product is either an intermediate product that's going to go somewhere else to be manufactured, or a final product that contains cannabinoids and it's meant for human consumption. And then because they created this intermediate, they just wanted to be clear that the intermediate hemp-derived cannabinoid product means that it's not in its final form. So it's something that you're going to use as like a baking ingredient or put into something else. And that also means, as far as FDA and USDA definitions, if you have like a packet of something, and in order to consume it, you have to put it in water, then that's an intermediate product, right? You're not just gonna like vitamin C's, right? You don't just like, I guess you could just eat that powder, but it's meant to be put in water, and then that is the final form. So all of that sounds all fine and good, but this is where um, this is really where patients are concerned. And what we see is that they also defined what is not hemp. And so they added, and so they're really looking at commerce, I think, and areas where they wanted this clearly defined. So they wanted to make sure that seeds for cannabis that are not, the hemp seeds, the ones that have actually been bred to produce less THC, that those seeds are not legal. In Europe, seeds have been considered collectibles, and so that has been their little loophole. But they just wanted to be clear that seeds that are being that someone can buy and then grow a plant that has high THC, those are not exempted. So that would mean that they are still Schedule 1. And so I think what's also important to understand is what they're defining. Everything that is not hemp, right, that's coming from this plant is Schedule 1. That is what's being defined. And so they're also saying that any intermediate hemp products that are containing cannabinoids that are not capable of being naturally produced. So this is the synthetics, right? That it doesn't, that if this Franken cannabinoid did not come from a plant, it is Schedule 1. Also, any cannabinoids that if they are capable of being naturally produced, but then they're synthesized, those are also not covered. And then anything that's more than 0.3% combined of THCs, or anything that has a similar effect. And we're going to start seeing some definitions coming out of HHS and FDA around what these exactly are. And then what also has been excluded, and again, you can tell they're really just making sure that they're clear what they're meaning. Is it in the final products, right? Same thing, that that synthetics are not allowed in these final products. That if they are being coming from the plant but have to be synthesized, those are illegal. And then this is really, I think, what is going to affect most patients, and that is that they have said that any final form product that has greater than 0.4 milligrams combined total per container, and they had a lot of fun trying to define a container, of, any sort of THC or what basically something that's going to get you high, then those are going to be illegal. And so what does this mean for patients? So good news, honestly, is that the Franken cannabinoids will be off the market. So we've really seen a bunch of products that really have been tested out on patients, right? Patients think that they're getting medicines. These things are being sold as mystery hemp extracts of some kind, and so those products, there's clarity there, but for state regulators, for patients, that those will be removed. Um, and in and then in 365 days, the hemp-derived products that will be legal will be non-intoxicating isolates. So, CBD, CBG, CBN, those isolates, broad spectrum hemp products. So things that have the terpenes, but just not more than 0.4 milligrams of THC. Um, and those will be the only legal products bought from this market. And so I'm going to use a slide that one of our advisors, Cody Pearson, created for our presentation yesterday. Is that during this time I've heard a lot of patients say, but you can only get full spectrum CBD from hemp. That's where it comes from. And that's just incorrect, right? Hemp is marijuana. That's the same plant. It is cannabis. It's one plant. It's just literally been defined by having a certain amount of THC. And now, why it might be true for a lot of patients that the only place they can access full spectrum CBD products is from the hemp market. These products can be found in other places if those markets will serve them. And so here's what we can do. First, I want us to really think about moving forward in our power as patients. So within the medical cannabis realm, there's 6 million of us, but there are estimates of up to 20 million people that are using cannabinoid-based products medicinally. We've moved to the point that 2/3 of medical professionals recognize that there's medical value. Majority of veterans want to see access to these products. But I also, I want us to really think about why you go in search of a loophole, right? But I also I'm not condemning loopholes. I want to be very clear. There would be no medical cannabis access without the creative use of loopholes. When we started Americans for Safe Access, until we were able to create product safety protocols for the supply chain of cannabis, the retail access that we had in states were very creative definitions of caregivers. And that was, for all intensive purposes, taking a Mack truck and putting it through a loophole. So, during this time, when we saw the first farm bill that created the research version, and then 2018 to now, I think we really have to examine, should we be looking for loopholes or permanent solutions? So we're up to 49 states, 4 territories that have some type of medical cannabis laws. We have created product safety protocols that were in the way for any sort of federal regulations of medical cannabis. We changed the scheduling priorities in the UN drug treaties that created our Controlled Substance Act that have always been a problem with the scheduling of cannabis. And I think most importantly, and again, like, this didn't just fall out of the sky because of all the work that we've been doing, that you all have been doing, our 2 top health agencies have said that cannabis has accepted medical use in the United States. Now, the scheduling part is another story, but this is a huge deal. This is what is at our sales, right? Since this conversation started with hemp, we were able to, remove this, make DEA remove the gateway theory. If you've noticed, only a few really old politicians talk about the gateway theory because we disproved it. And proof of this is, you just go look on NIDA's website. They say, but that there is not a gateway theory. This is because of our work. So this crazy conversation is off the table. The National Academies of Health, said that there's conclusive and substantial evidence that these medicines work. And again, this was not part of the conversation. This was not a tool in our toolbox in 2014 and leading up to the hemp bill. During the opioid epidemic, we organized to expand our state laws to include pain. And for folks who weren't around before 2016, most state laws, law enforcement would work very hard to make sure that pain was not included in these state laws. And because of the work of patients, now pain is not only in every state law, but we've even moved further that in some states where patients can take a prescription for opioids and have access to medical cannabis. So again, the way that people are seeing medical cannabis, including medical professionals, is more of a tool to help patients than again, a loophole. We have all these universities that are now educating specialists in cannabis. This is the environment that we're working in. This is the environment you built. This is who we are when we talk to members of Congress and the press. WHO has recognized that there is unequivocally medical value to cannabis. And again, the drug treaties that have been held over our head and created the Controlled Substance Act in the first place have reclassified cannabis in their trade agreements. And so this is no longer something that DEA can hold over our heads. Our opponents can say, oh, we can't allow you to use medical cannabis because we would be breaking drug treaties. We have seen research centers open up across the country that are being funded by states. We're not just depending on NIDA's funding to prove the harms of cannabis, right? We have so much more, research and resources to help politicians understand, what our medicine, that our medicine works and why. We passed the bipartisan research bill with our biggest opponents leading the way. And in this, not only, did we create some lasting abatement for, barriers for research, but we also codified a doctor's right to recommend cannabis beyond just their First Amendment rights. We've seen states step up and put out dosing guidelines, tools that doctors can use. They're not just going blind. And there's 60 countries right now and more every day that are tackling this issue. And the United States is not one of them, right? This is not some crazy thing that we invented in our basement. Countries are seeing the value of medical cannabis and what it can mean for their citizens. And the International Narcotics Control Board that oversees the drug treaties has put out instructions for countries of how they can run medical cannabis programs and stay in line with those drug treaties, right? Like, this is how you do it, right? You don't just ignore the fact that you have 49 states trying to figure this out yourself. Instead of us just, trying to convince people that cannabis is safe, our talking points now come from the FDA's Center of Drug Evaluation, right? Who has said that there's evidence from these reviews that, the safety concerns are not greater than the benefits. We've known this for years, but this is what our members of Congress need to understand. This is what our policymakers need to say, look, unless you have decided to be the only arbitrator of medicine in this country, let's start looking and seeing the ground that we've won. And we're seeing, cannabis play a huge role in the health of humans in this country. This isn't just something that people are using in addition to, but they're actually using less of other medications, which is having all sorts of benefit to those individual patients, but also to our healthcare systems. We're seeing this, across, all sorts of varieties of conditions. And honestly, a lot of these are conditions that there is not an equivalent or another product that can be used. So this is who we are. This is what we're fighting for. The American Nurses Association has officially recognized cannabis nursing as a specialty nursing practice. And then, of course, the thing that we've been fighting for, and honestly was in the strategic plan we created at Americans for Safe Access in 2002, HHS finding that there's currently accepted medical use was supposed to be the end of Act One. And I think that for a lot of us, we were pretty frustrated when this announcement came out and all the news coverage was focused on businesses. It was all focused on tax deductions. It was all focused on, the politics that, Biden was using this to get reelected, which was all manufactured misinformation. And it's sort of like the news coverage that we just saw around the hemp bill. I mean, how many headlines did you guys see about full spectrum cannabis being left out for patients? So, sorry, this is actually where the loophole is supposed to go. So I think we need to know what we're fighting for, and this has really been hard as I've come back to the United States and started working on policy again. um, there are a lot of new people in this space, right? I would say that probably 80% of people that are involved in medical cannabis or cannabis, whether it's in the business side of things or as a caregiver or as a consumer or patient, that they just got involved in the last 5 years, right? And so so they don't understand the political background. They don't understand that we went to the states as a triage measure so that we could remove these huge barriers like product safety protocols and the scheduling of cannabis in our drug treaties, that should signal that it's now time for us to integrate cannabis into our healthcare system and restore our rights as patients. Because we're stuck in this perpetual place where our stakeholders can't communicate. You can't. I mean, imagine if we tried to do this with any other medicine. Imagine if at the beginning of the pandemic, if Congress would have turned to a pharmaceutical company and asked them to create a vaccine for Rhode Island, right? Like nobody would do that. And so, the companies who got in the space to serve patients, they can't make it, right? And that's where we're seeing these changes in markets. And honestly, it seems that patients are always the ones that are left out of these conversations. Under the hemp market, while the possession of those products were legal, patients were still being denied federal rights because of the THC in those products. um, you know, Active military cannot use hemp products, right? They're specifically all of the codes of the military have said, we're not just talking about cannabis. You cannot use hemp. You cannot use CBD. Patients who need to travel are fearful of having their medication taken, and it's really have changed like how we live. um, Patients that are going into hospices, hospitals, or long-term care, they're not being able to use CBD. These nurses aren't letting them use these products because there's confusion. And sure, you could probably sue them, but honestly, there hasn't been a successful lawsuit. If you are inhaling a product, you can get kicked out of not just subsidized housing, but you have no protections under the Fair Housing Act to fight for your ability to stay somewhere. And yes, the courts are trying to figure out how to look at Second Amendment and medical cannabis. But right now, if you have THC in your system, arguably you can have a gun. And so there's also, when patients get put into other communities, right, where if we're fighting for medical cannabis in, um, as just another hemp derived cannabinoid consumer, which let's face it, was really focused on intoxicating hemps, and that's what we saw the lobby focus on. Or if we get thrown into these sort of general definitions of cannabis, that there isn't a pathway for us. All of these markets want to try to put cannabis in the FDA, which the FDA has already said what they think about medical cannabis. We either have to go through this crazy drug development or it's not medicine. And I'm sorry, but FDA approved does not mean medicine, even though that is what US healthcare um, thinks, whether it's our doctors or insurers. But there's a lot of other definitions of medicine, and FDA just, they can't have it. We've been fighting to again have medical cannabis, a part of um, our healthcare systems, so that we can have insurance coverage. And I'm not just talking about prescription drugs, also over the counter, but that they're recognized, and so that we also have established federal rights. So it's not just the hemp bill, right? There's the scheduling thing that's up in the air. All of these things are, everyone is looking at what we're going to do with cannabis. And this is because of the work that we've been doing. You know, medical cannabis patient advocates, you're the one who flipped this board. This is why people are having this conversation. And so we finally got everyone to start looking at this, and patients aren't coming to the table. And I'll just tell you, if you have not talked to your member of Congress, um, or your senators in the last 2 years, they don't know that patients are having a problem with this. And remember, you don't have to know all the answers. If you just call your member of Congress and say, I'm afraid of what just happened. I know I'm not going to have access. I need you to pay attention to this, because if they don't hear from you, they are not going to deal with this. There's a lot going on in this country right now. And what we've been working on for 23 years at Americans for Safe Access is actually what we've helped build in other countries. And that's actually creating an Office of Medical Cannabis in HHS that would actually deal with all cannabinoid products. And there would not be a definition of hemp within that, because we would be defining the products, right? Cannabis, we go back to this cannabis being one plant, and then there's industrial hemp. But unlike other countries that don't necessarily have the crazy war on drugs we have, we're going to have to create a new schedule in order to move this forward and take DEA completely out of the equation. But as we do this, we're not just going to start from scratch. We've learned a lot from the state programs. We're going to take the best of what we've learned, because let's face it, it's not just the CSA that's the only barrier of patients having access to medical cannabis nationally. We also, there's not a framework for complex botanicals. So we've got to create those policies to make them happen. And so, as you're dealing with this fear right now of the unknown, as these laws are changing, I just want to remind people, like, one, this was always coming. From the day after the Farm Bill passed, DEA said that they thought these things were illegal. It's just gone on for a very long time. And I'm very sorry for those patients who had no idea this was happening. But it's here. And, as Congress was looking at how to deal with regulating these products, the industry associations that represent the hemp industries, the ones who many of you have been relying on to get your medicine, they didn't fight for patients when they had a chance to. They didn't say in their meetings with senators and with Andy Harris, let's just make sure no matter what we do that full spectrum CBD products remain legal. Instead, they put their heels in and said that we have to have 10 milligram THC for these products. That was not about patients. That was about intoxicating hemp. And so I just want, as we're thinking about moving forward, just remember, what it is we want, right? I've been doing this for 23 years, and honestly, I don't want to think about my medicine this much. I want to have, my medicine available when I need it, and I don't want it to define me. And the proposals that we're talking about, as far as creating a new schedule and creating a new framework, this isn't something that we just made up. This isn't a siloed conversation that just ASA is having. This is a part of the dialogue in DC. The problem is that they're not hearing from patients as much as they're hearing from industry lobbyists and anti-cannabis lobbyists and drug testing companies. And so if we want Congress to look for a solution for us, we have to make sure that they know that we're here and we want it. But hemp isn't the only thing going on. So I just want people also to understand, there's obviously the scheduling thing that's going on, but honestly, none of those schedules work for patients, A. And B, the chance of descheduling happening anytime soon is just not what's happening on the Hill. I know that over a lot of social media channels, people are having a debate about Schedule 3 versus descheduling. The only place that debate is happening is on social media. That is not a question that's happening in DC. And so, I think we're also just seeing people making a lot of, every little statement that Trump says. If you actually read, the statement he said at a press conference that had nothing to do with medical cannabis, he basically said that there's, good things about medical and everything else is bad. I don't agree with that, but how can you read that and think that descheduling is a possibility, or even, put your eggs in the basket that he would move forward with Schedule 3, right? This sounds like a Schedule 2 statement to me if I've ever heard one. But again, Schedule 3 isn't just Schedule 3. What was proposed by the DEA in the rescheduling process, it looks like this, right? And with what's happening with the hemp bill, this is going to get even crazier. And so, the devil's in the details. We can't just throw out a soundbite and hope that this gets taken care of. Lots of every time Trump says something, stocks go up, but people aren't really looking at the reality. So, a few weeks ago we saw these headlines, and I had to figure out like what is going on. I thought that like Trump woke up and was smoking a joint on the front lawn by all the news. But it turned out that the news was about this post. This is what it looked like on his thread that you can't even tell what it is. There's no comment. He didn't, write something exciting. He just posted on there. And this is a post from someone who is a very big financial contributor. And so I don't necessarily think that means much, except for you can buy your way onto his Truth Social post. But there's something else that's going on behind all of this, and I know people are tired of hearing about Project 2025, but I need folks to wake up and know that this was not a spoof, that this administration has been going through a checklist. Now, they didn't tell us what order they're in, but they're halfway through the mandates in this report. And cannabis is in this report. Now, for some reason, they're very focused on RICO. I think maybe they just don't understand the power of the drug laws. But there are several sites within 2025 where they talk about utilizing RICO to go in and protect citizens from drug laws. That means us, right? And of course, we have medical cannabis has some protections under the CJS amendment, but adult use has no legal protections. And, again, I've been talking about this for a long time, and people have sort of thought I was crazy. But a few weeks before the shutdown, there was a committee oversight hearing for oversight, investigations, and accountability that included that came from the chairman of Oklahoma, who brought an Oklahoma narcotics agent to speak, along with a Heritage Foundation, one of the authors of the Project 2025. And the outcome of that hearing was that they have requested a RICO task force for marijuana. So this is happening. And what again, they're going to find once they start this RICO task force is actually they don't need to pass any new laws. They can actually just start enforcing federal cannabis laws. there's a return of drug war rhetoric. We stopped for years, stopped hearing anything about the drug war, and we had more of a harm reduction approach. But there's a backlash to that, and so we're back to war dialogue, and it's confusing. And so I just also want to point out that we've created lots of resources for folks, like around the scheduling, what's really happening, what's really meaning. You can always check out our blog. I literally took everything we've written about scheduling and put it in this blog post for you guys. So check it out. um, but I also, a lot of people make fun of our opponents, and I just want folks to realize that our opponents are getting stronger and stronger, and they don't sound crazy. And in fact, a lot of the talking points that are coming out of organizations like SAM are the same talking points I hear coming out of a lot of cannabis advocates, right, who don't want to see big marijuana, right? And so um, these groups, as as industries keep ignoring things like youth education, drug driving, they're growing more and more power. And unfortunately, that their allies in Congress and Senate, um, you know, there are some that signed this letter years ago saying that they disagreed with Schedule 3. They're now all in leadership, like literally all of all of them are chairing committees of appropriations. That's why we're seeing this move forward. And so, just know that as you're talking to your members of Congress, that you've got to cut through that noise. And so showing up and saying that you're fighting, that you're just fighting for medical cannabis right now, they're gonna, and especially if you're talking about hemp, um, people are really distrustful right now of the hemp market, that was saying patience, to get in the door, and then we're saying intoxicating hemp when they rolled up their sleeves to write language. And so we have options, right? And this is, we'll be rolling out a lot of action alerts and things for folks to start participating in these. But at the state level, I think there's a responsibility here, especially since patients were moving to the hemp market for states that had medical cannabis laws, um, because taxation was just too expensive. Like patients just could not afford these high CBD products in these markets. And in a lot of cases, they just stopped making them. And so we're drafting right now some emergency regulations and legislation that states can pass to make sure that in 365 days, we don't see a shortage of patients who need these products. And, in some states that actually can step in and tell businesses what to do, if they really think this is an emergency, they can use some of those laws. That's definitely the nuclear option, so to speak. But they can also offer tax incentives and even subsidies for people to grow high CBD plants within both the regulated market, or create allowances for regulated marijuana cannabis manufacturers and states to buy high CBD from USDA licensed businesses in their state. But I also want to see public education happening for patients around things like shelf life of cannabinoids. I don't want to see a lot of folks, buying up products that they won't be able to use. So just understanding, really what patients can do to prepare. Um, and also remember that we've also been dealing with a lot of contaminants in these markets. Like this wasn't like some beautiful, wonderful market that is now being taken away. There were challenges, and I think what if we don't figure this out in 365 days, we're just going to see a huge illicit market. Um, and we really need to figure out how patients can transition, back into, let's say, if they need to, into a medical cannabis market. Maybe that means, removing, like having a waiver of ID cards and other things, and what that would look like, because a lot of, the 20 million people that are using these cannabinoid products, they've never gotten an ID card at the state level. So we just need to be smart about, what this means. And again, um, I don't believe that we're going to be getting our medicine from the state level forever, but we have to make sure that those 20 million patients aren't left stranded. Um, But within the minibus bill, there was actually a requirement for FDA to start defining some cannabinoids. So we're, finding some ways to, get patients involved in those conversations. But remember the minibus that I hope I never have to say minibus again, by the way, after this appropriation cycle. But HHS and CJS, those spending bills were just extended to January 30th, right? And so we have things that we have to deal with in those bills anyway, like the crawback of our protections. But when we're looking at, what we want for a medical cannabis program, those opportunities um, are both in um, uh, the Department of Justice, within DEA, and potentially within HHS. So we're going to be, looking at some of the asks that we've had in the past, but how else can we use the situation to get those agencies to start moving towards a federal medical cannabis program? And then there is our federal legislation, which again would create an Office of Medical Cannabis, a new schedule that removes all the criminal penalties from cannabis. We're not using the terms decriminalization, but I just want to remind people, a lot of states have decriminalized cannabis without descheduling it. Those two words are not synonymous. Um, and, I think that, we need to see um, this advance. And I feel like we're not at a place right now where we're just going to hang out on a plateau forever. We're actually seeing, um, you know, our opponents come after us, and they're winning, right? We're probably going to see a crawback to our protections within the medical cannabis programs, and we'll potentially start seeing Department of Justice closing down medical cannabis businesses. So our bill, it is in legislative council. We're trying really hard. DC is just a weird place, y'all, right now. But we're looking at options of, if of actually introducing sort of a pared down version, which is called a spot bill, which means, that legislation won't pass as is. You still have to put all of the details in. But it puts the sort of framework out there, so it's part of the conversation. It makes it easier for patient advocates to talk to their members of Congress about this. And this could happen as soon as second or third week of December, or potentially in the new year. But when you're talking to your members of Congress about what just happened in the hemp bill, are you upset that you can't get those products from businesses that are classified as hemp? Are you upset that those products are not available to you because there's not a recognition of cannabis as a medicine? And so just because people have utilized patients, to get through their loopholes, doesn't mean we have to accept those identities. And as soon as patients can step up and say, these people don't speak for me, cannabis businesses don't, cannabis regulators don't speak for me, this is what patients need, sooner that we're going to, have elected officials helping us figure out how to solve this. Okay, so here's the big, we got to show up. And I know I say this all the time. I'm sorry if you're on, hear me speak a lot, but I just want everyone after this presentation to look in the mirror and be like, do you want this? Do you want cannabis to be available as a medicine in the United States? Do you want your federal rights back? Right? Or do you like getting your medicine from the illicit market? Or do you like being part of a subculture? And that's fine, right? But don't complain that you don't have federal rights or that you can't find these products if you're not going to at least call your member of Congress. And I know that sounds really self-righteous, but I haven't slept for a week. I'm feeling a little self-righteous right now. And so the next time, you hear somebody complaining about medical cannabis or what's happening federally, ask them what their member of Congress said when they told them that they needed access. And if they say, I don't know, then pick up the phone and help them call them. right? Because there is no room for complaining. And actually, one of my mentors, and actually the author of the protections of the CJS amendment, Congressman Sam Farr, used to always say that politics in America is not a spectator sport. You have to get involved. Like this isn't like if the Cowboys win, you get to keep on drinking beer, right? Like we're getting to a point that if we lose, this may not be an area of medicine that is funded or that we continue to look at. Medical cannabis, we are going to create a gateway to better medicine. That is what we're talking about, is changing how we approach medicine in this country. And if we lose, there isn't somebody else fighting for this, right? The reason we don't have complex botanicals in our pharmacies in this country is because we don't have an agency in this country that decides what is good medicine. The FDA is a consumer protection agency that evaluates when a company says, this is a medicine, I put this on the label, they're just evaluating whether that company, is labeling their products correctly. They're not sitting down and being like, what would be a better medicine? A non-toxic complex botanical. But because our medicine can't be patented, because there isn't someone that's going to make $1 billion right away off our medicine, no one is doing that, and no one has created that pathway. And that's what we're a part of. That's what we're doing. This isn't just about us getting our medicine right now. This is about how patients are going to be treated at onset of diagnosis, right? Myself, I had my kidneys were failing before my doctor thought to bring up cannabis to me, right? What if at my diagnosis, if he said, what would be a better anti-inflammatory? Cannabis, right? That's what we're fighting for. And I know that it could be scary to talk to your member of Congress. It's if you haven't done it yet, it feels super intimidating. But as soon as you do it, it's pretty easy, right? And it doesn't just mean that you have to wait for a lobby day to come to DC. As you are seeing, if there's a story in your local paper about cannabis, and my guess is in the last week there was a story in your local paper about hemp, why don't you take that story and forward it to your member of Congress, to your senators, and say, hey, I know this is what the headlines say, but I'm really in trouble because of this. And we really need to talk about long-term solutions for medical cannabis, right? Yes, I send out alerts all the time that have pre-written letters, and those are important, but creating relationships with your elected officials is how we're going to do this. You don't have to love everything they do, but you know what? The only reason they're turning to lobbyists to figure out what to do is because you haven't shown them that you're a resource. If you say, hey, I'm a patient in your district, if you want to know what this means for patients, call me. I'm here. Call me. And I think that often I find that people get really intimidated by the details in the solutions, right? It's much easier to say, no, I don't want that, right? Like back in the day of like DEA, go away. That was pretty awesome policy. But you don't have to be intimidated, and we definitely create a lot of resources for patients, patient advocates, to feel more comfortable answering questions. But unless you introduce yourself as a legal scholar, or a government affairs director, then people aren't expecting you to know everything about the legislation. You can show them the tools and connect them to us at ASA, and we can help guide them and connect them with government affairs folks. What we, as a patient advocate, your role is just to let elected officials and let hospital administrators and the PTA know that they need to be thinking about medical cannabis patients. You don't have to necessarily have the answer. You just need to point them in the direction. But again, one of the reasons that it feels like, the issues of medical cannabis are just getting scabbed over is because we're not stepping up and saying that we need consideration. So the same thing, I know people get really frustrated with letter senator. I know people may not know this, but people actually still read newspapers. And in fact, there's a lot of research that says that people come up with their political opinions based on things that they read in the editorial section. And so I created this new guide for folks on how to submit the letters and get them published. And I just want to challenge you all. Like if you're feeling anxious, I know you've already in your head like come up with the speech you want to say to somebody about what the change in hemp law means for you. When you get off the call, if you just do a search of your local newspapers and hemp and find the story that they wrote, they might have just reprinted something, it doesn't matter, and then go to the editorial section or go to this manual. I've actually found the instructions for most major papers across the country, and send an email that you use the title of the letter of the article that they wrote, right? They've already published something. So you're saying to the editor, you're writing a letter saying, hey, editor, you published this article and here's what you forgot. That's what letters to the editor are, right? And so one of the reasons that people don't get published is that they're sending things that the paper's not even talking about. So in this opportunity, everyone is talking about this. And I guarantee you, if they talked about patients, it was maybe an and/or statement. And if you want your local paper and you want your local politicians to talk about patients, you have to tell them that they're leaving us out. They don't know. And again, your letter to the editor, you don't have to come up with the policy solutions. You can say, yes, supposedly there's a $28 billion industry that's affected, but I'm not sure if I'm going to be able to stay off disability if these products don't get mentioned. I'm not sure if my kid can go back to school when their seizures return, right? And again, that's all you have to say. There's a bigger thing happening here. Also, just we have to get out of the internet and stop just talking to ourselves, right? I know that sometimes it can feel really good to get in a debate over social media. Your adrenaline gets going, but what do you win if you win that debate? RJ, I love pot, stops following you. Is that your win? So we have all these resources, if you want a table at events, I have it like, here's how-to table, and go into your community. 90% of this country agrees with us, y'all. Like there's no other issue like this. But what they don't know is that we need their help, is that we need them to get involved. Again, you don't have to like give up your life and be a crazy activist. Just the next time you're going to your dispensary or you're going to the grocery store or you're going on campus or to do laundry, go print up one of these posters that I made them as ink light as possible so you can print them at home and just take some tape and put it up somewhere, right? There's other one pagers, take them and hand them out to people. We've got because I can tell you right now, if we could win this by the people that we're talking to on social media, we would have already won. Because I always win those debates. Just kidding. But there's also some other resources that are coming up. I know a lot of people have been asking us about the State of the States report that grades states, and we actually did not put out one last year because we wanted to kind of take a break because honestly those reports got a little depressing. But we're putting out instead, we're still going to grade the states, but instead of just looking at states as individual programs, we're actually going to look at them through the lens of like, are they ready for a federal medical cannabis program? Like what are going to be the requirements at the state level after we win and have a national program, but also really look at like, what have we learned? What are some of the things that we want to take with us in a national program, and what are the gaps? And let's start talking about our state programs, not as the end of, not as our goal, but as a laboratory of democracy to figure out how we are going to do this new thing. And the new thing isn't get cannabis to people. The new thing is to classify complex botanicals as a medicine. So there's opportunities there to volunteer if you want to help with so much data that we're pulling together. Obviously, as you see my presentations, I could always use help with some graphics and other parts of the report. So that's another way that you can jump in and get involved. And the other is just make sure that we have some gas in our tank to do this work. I mean, in full disclosure, I don't know how things would have turned out around appropriations or this bill if we had the resources that we had, for instance, when we passed the CJS amendment in 2014. Having a full staff that includes communication staff and people on Capitol Hill representing patients makes a big difference. And I'm doing the best I can, but I'm honestly a full-time volunteer as well. And so, there are the way that philanthropy works in this country now is that there are no more big donors. And one of the reasons we've been able to survive over all these years is that we've never been dependent on one billionaire. And so if you are looking at your bank account, like I only have, I can only give $10, what could that actually do? Well, if everyone on that call is thinking the same thing, then I can pay the bill to keep our website up. All right, we can start hiring representation on DC, for us in Capitol Hill. And again, I'm up there. We're trying to get, as best we can. But I honestly think that part of the stagnation is that we just don't have the resources. And so as you're thinking about what to do next after you get off this call, I just want, if there's any way that I can impress upon you, that we're not losing because people disagree with us necessarily. We're losing because we can't afford to buy the ticket to the dinner, right? Like honestly, like we're not showing up. And, if you don't believe me, go ask somebody, what they think about a national medical cannabis program. And they're going to tell you, I never heard of that. Right? Like this is what we at ASA have been working on for 25 years, but no one has told them that there's even a plan that this could actually be a part of our medicine. Right? So let's fuel this thing. Let's get this done. Again, when I was a cocky 25-year-old starting ASA, I had no idea that I would still be doing this long. I don't want to do this for another 23 years. I honestly need to come up with a retirement plan. But we're also ASA, we're not building an institution. It may seem like that just because this work is hard, but Americans for Safe Access, we are a campaign, right? That our goal is to put ourselves out of business. And obviously, there's a lot of work to do that. It's not just passing laws, but it's implementing them, making sure that everyone's following those laws. But we don't have to do this forever if we all chip in. And so with that, I'm going to try to figure out how to answer some questions. Oh, thanks for the hearts, y'all. I appreciate it. Let's see. So did folks put questions in the Q&A? So someone asked, hemp seeds for consumption are still legal? Yes. So hemp seeds for consumption are classified as foodstuffs. And they're also, you can't take those products and put them in the ground and grow as a finished product. They won't grow a plant for you. And so those foodstuffs are safe, and that's part of what some of those farmers have been fighting for a long time. And there's another question that says, what about the Global Commission on Drug Policy? What about them? I don't even know if they still are around. I mean, they were definitely, we're doing a lot of work at a period of time, so I'm not sure what you mean by what about them. I know about them, but I actually haven't seen them in a while. And, when we look at the global landscape, I mean, I want to be clear about something to folks, right? Like, and this is, it can maybe helpful for some of you, but globally, like on this planet, the issue of medical cannabis is killing it, right? Like people are learning more about this plant. We're learning through, being able to use sophisticated tools. We're now able to understand, what complex botanicals can do in the human body. We've changed the scheduling in the drug treaties. We have all these countries moving forward. We're not finished, obviously, But things are advancing, including our understanding of this plant. But I think a lot of people confuse the success of cannabis businesses and the success of the medical cannabis movement. And so, you know, there could be a scenario, right, that if we don't pass federal legislation to create the botanical landscape we want, I would love for farmers here to be growing my medicine like they are right now. But there could be a scenario where we're importing cannabis products from other countries that allowed the science to move forward, right? Like, this technology isn't dependent on whether or not the current businesses providing cannabis will be doing so in the future. Okay, do you guys see the Q&A? Oh, people are putting them in. Okay, I'm looking at Q&A. I see people putting stuff in the chat. Okay. Um, okay, good. They're still active. Do we know what legislators pushed to take medical cannabis away from veterans at the last minute and why? Felicia, I am trying to get a better sense of that. Honestly, this has been something that we have been advocating for alongside veterans organizations for over a decade. And in the last few years, the Senate, we weren't passing it in the Senate version, and it was taken out in conference. And so the fact that this was taken out after we, did our job and had it included in um, both the House and Senate versions it's really cruel, honestly. And, as far as a strategy of utilizing the appropriations budget to make that change, we won't have an opportunity to do that again until September. But we were actually, before the minibus came on, I was actually working with several veterans organizations to actually deal with an issue that would come up if that did move forward without some other changes. And that is, something we've been trying to get the VHA to do for a long time, is actually create a category in the electronic record system for veterans, so that when a medical provider within the VA system is talking to their patient about medical cannabis, they can catalog it as something other than cannabis use disorder. And so let's say if that would have moved forward as is, when a VA doctor went to fill out the paperwork for a veteran to use the state program, when they went to actually codify that in their medical records, they would have to say that patient has cannabis use disorder, and creates all sorts of other problems. So and there's other ways besides appropriations that we can be changing that policy. That policy doesn't require, it's based on an internal military policy that actually doesn't require Congress to change it. After the 365 days, feminized seeds that grow cannabis plants containing. Yes. Okay. So someone's asking about seeds and the 365 days and the state medical cannabis programs at state. So remember that, so the hemp bill is a federal bill that is not weighing in on what the states have been doing. The state medical cannabis programs and state adult use programs, those are actually operating completely outside of the Controlled Substance Act and making up their own rules. Now, if those seeds are coming from an adult use facility in a state that has home cultivation, those are more exposed, right? Because they're not protected by the CJS amendment. But what we're talking about is really just things that are part of the hemp market. Does it affect? So no, this does not affect the state programs again, but the challenge has been, I think, when you really look at, why patients were going to the hemp market, and the briefing that we did yesterday, that I'm hoping to have up on YouTube later, really kind of dives into that. That patients went to the hemp market in search of these products because of the expense, right? Because there's so much taxation in the regulated cannabis markets. And honestly, a lot of those laws were created to let as few people as possible be able to use them. And then also, as we see, adult use come into some of these states, especially where they're merged, patients found themselves competing with adult use consumers for items on the shelves in these retail places, which, you know, um, uh, a lot of the consumers in that market are just looking for very intoxicating products. And so there's nothing prohibiting right now people within the state who have adult use or medical license to cultivate, manufacture, or distribute cannabis to be producing these products. They have just chosen not to. Um, yes, it is a great book. Thank you. And I love the aging well um, component. Um, but yes, this is, um, I think that, a lot of people who see how much access we have, whether it's under hemp or under the state programs, think that like our battle's over. Um, but I feel like if we were to stop today, and I would have to look back at the organization, I would have to, rename it Privileged Americans for Safe Access to take to feel like we've won anything, because there's still a lot of people left out of all of those programs. Um, yes, so I'm not sure if that's Sasha or who from the Realm of Caring Foundation um, uh, has talked about people joining research, um, which is a huge thing. Like I know a lot of us, we've fought for the right for research, but then once we get that right, people aren't participating in it. And so if you want to send me an email, I'm happy to, I'll actually add a slide about that in the notes. Um, Um, so someone asked me what I see happening with hemp-derived beverages, THC beverages, so intoxicating hemp beverages. Um, I mean, I think that I mean, I'm sure there's a bunch of people trying to figure out how to create a single serving product that would allow people to get intoxicated from zero point 0.4 milligrams. Um, but I think, for the most part, those products are going to have to go through the cannabis markets in states that have passed legalization. Um, but I don't think they're going to continue to operate the way they are. And I know a lot of people felt like when they saw, alcohol companies getting involved and they started seeing like Target and um, Circle K selling them, that I kept hearing this phrase that's, the toothpaste is out of the tube, or you can't put the toothpaste back in the tube. Um, and while I mean, it sounded big, it was definitely exciting. But alcohol is a different monster, right? Like, alcohol companies have the ability to introduce new products into the market pretty quickly, a new SKU of products, and take them off pretty quickly without much, without going bankrupt. And this is actually something that alcohol companies constantly deal with, right? They've had to deal with taking caffeinated products off the market. They've had to deal with energy drink, products being taken off, or various flavors. So I don't know. And I think that, ultimately, as we win, right? Like you use loopholes because there's no other option, right? They're a necessity. But as you start winning, right, it means you're giving up the loophole, right? You're saying like, okay, we're gonna figure this out together. Now you might not like that solution, but that's where we're either going to integrate cannabis into our society, or it's going to remain an illicit product. It's part of a subculture, which is fine. I mean, if people like, if that's where people want to get their cannabis and not be a part of this, that I think that's fine. But if you are if we're moving into being legal, that means getting rid of loopholes, right? And I think that if what I'm most afraid of that was going to come out of this sort of activity over the next 365 days is that patients, continue to be used by the hemp lobby as the sort of um, face of their products, when really we know that they're pushing for other products, not necessarily patient's medicine, instead of looking for solutions there for their own. Because I really believe that we're in a different world. Like, we've created a space, right, where politicians may be ready just to give us what we want, um, and not force us to look into loopholes if we ask. And at some point, loopholes become rabbit holes, right? And unless we, are really fighting for a legal market and for these protections, again, we've got to focus on laws that are going to protect patients. And of course, there are other stakeholders that are involved. But you know, there's no other market where patients are being asked to give up so much so that people can be intoxicated by their medicine. Can this action by Congress benefit? Yes. So the Schedule 6 idea, and thank you for bringing it up. So I don't know how many of you have actually tried to have a conversation with someone about ACE's legislation. People get, really nervous about bringing it up because people, when you first say Schedule 6, they're like, "Oh, that'll never happen." And I just, want to remind people that, like, laws are written by humans. Before 1970, there were no schedules. And if you, and in my experience, if you number things as, um, starting at 1 to 1, 2, 3, 4, that means that there could be other numbers added, right? Otherwise, you would number them the other way, right? So if you have a 5, it makes sense you would have a 6. And I think that there's a lot of people who really live in a cannabis bubble, and really think that the whole world is behind us and everybody loves cannabis and everybody wants to see, they want to see it in the water. They want to see it, everywhere. And, the reality of where we are in the United States when it comes to cannabis policy is that we are walking on thin ice, right? And where we see the most protection is actually around, or most support is for patients, right? And so what is doing us a disservice is that when, a door is open because somebody says they want to talk about patients, and they get in the door and they start talking about these other issues in our name, right? People think that there is no patient issue, that it's all just smoke and mirrors. And so, you know, the conversations that are happening on Capitol Hill are not like, how can we help these businesses make as much money as possible? That is not a conversation that's happening, right? There's conversations that are like, how do we prevent another, company or another set of products that will act like tobacco or alcohol and lie to people. But no one is saying, you know what, I bet marijuana is just better for you than alcohol, right? That's not a conversation that, like, safer than, actually the truth is a lot of people in this country don't want people to use anything to get high or to even alcohol. The truth is there's a lot of people who, are really scared about their teenagers using these products that honestly, the the conversation about unsafe products in the hemp market is also a conversation that we need to be having within the regulated market, right? Like, is shatter safe? Is it safe for humans to have that much THC every single day? I don't think anyone should go to jail for that, but I do know that in our society, if any other industry, if alcohol or tobacco or pharmaceuticals started putting out products they had no idea what would happen and marketed them to us and to children, we would lose our shit. Excuse me, we would lose our mind. But that, because it's like we're in this limbo, Patients often are in the situation, it's like we have to take what we're given. And I just, again, I want to really empower people. There is no cannabis sales outside of an illicit, solely illicit market without you, without patients, right? That all of this exists because of you. And so for people that are doing things in your name, yeah, I think we have a right to speak for ourselves. So somebody asked, what is the probability that after they legislate to allow 0.3 THC, right, dry weight, full spectrum, and only ban synthesized compounds, and only ban, so what's going to be happening in the next um six or next 90 days around for at the DEA to define some of these cannabinoids is where we're going to start seeing answers. And honestly, I think there's going to be um, another definition that's thrown in. So if you saw in the language, they referred to products that were both, intermediate or final to describe those products. And when talking about cannabinoids, they talked about ones that were naturally available from the plant. They talked about ones that were naturally available from the plant, but then needed to be synthesized, right? So that's moving from, acid like THCA to THC at some level, but also some other kind of Frankenstein-y stuff that we've seen, like creating Delta 8 from I'm not sure where. And then another category that is just completely synthetic. Um, but I think that as we move into more regulations, there's potentially another category, and that is, especially when we move on to talking about safety profiles, this may not come up in sort of this conversation about the legality, is, what naturally comes from the plant that is in, commercially available quantities, right? So a lot of these cannabinoids like Delta 8 that have become popular, they've been they're present in the plant, but humans have just never taken that much, right? They don't, you would have to naturally derive the amount of THC Delta 8 from the existing varieties of cannabis we know. You would be growing like a football field for one, for one um, uh, serving, right? And um, so I think that a lot of these sort of definitions are still up in the air, and this is a place where you can participate as well. So if you signed up for this town hall and you are not signed up otherwise to get ASA's emails or to volunteer, you can find all of that on the website. This is going, working in medical cannabis policy is like being at the airport. We have to hurry up and wait all the time. So the way that a lot of the policy work happens is that there's like nothing for 6 months, and then all of a sudden there's like 10 things we have to do. And we definitely stay on top of that and can give people a heads up when things are happening that need your immediate attention. But I can't rely on the algorithms in social media to tell you that, because for some reason I can't just tell people who like me. I can't talk to them without paying for ads. But if you're signed up for email, and especially if you put info at Safe Access in your contacts, I can email you and tell you that when those are happening. Are there any last questions before we've got 2 minutes here? And so what I'll also do is I'll take these questions that are in here, and I'll add some slides with them because they were really great questions. And I just want to close by saying, don't be intimidated by what's happening. If you are surprised that this is happening, it doesn't mean that you're foolish. There were a lot of companies, paying a lot of money to make people feel like these products were legal, right? There's a lot of people paying a lot of money to make people believe that cannabis is going to be rescheduled any day now. And this is while we're starting Act Two, we have to remember, like, this fight actually started arguably in 1970. Some people think it started in 1937. So this is People always say it's a marathon instead of a sprint. I feel like it's more like a relay race because sometimes we have to sprint. But it's okay to ask questions. Reach out, reach out to me by email. You all got my email because I sent you the Zoom. Reach out on social media. Also be patient and know that if you want me to answer more questions fast, help me raise money to bring on staff. But just don't feel gaslit. Don't feel like, you didn't understand something because there's something wrong with you. This is really complicated, right? Medical cannabis, you have to understand biology, you have to understand physiology, you have to understand drug development, you have to understand criminal law, you have to understand civil law, you have to understand consumer protections and product safety protocols. This is a lot, right? And I wouldn't necessarily, recommend spending as much time as I do figuring all of this out. But I also think it's a really important time to not necessarily, you don't need to win people over. I'm not sending you out in the world to do that because honestly, enough people already agree with us. We don't need, like, if people disagree with us, that means that they're part of 4%. Move on. But for those who do agree with us, chances are they're getting some really bad information or misinformation. So we just have to be mindful to correct misinformation. Congress did not just ban hemp. That is not what happened. Um, Congress made a very responsible step in some regards of letting the industrial hemp that has fought so hard for a legal right to create these products here to have a viable market, right? So that they're not caught up in this debate about cannabinoids. That is amazing. We don't have to get our hemp seeds to eat from Canada. This can make jobs here in the United States. We are going to see, we're not gonna have to worry like what a synthetic cannabinoid is. There's no question that these are not legal and they'll be taken off the shelves, right? That just happened. Those are huge wins, right? And the other components about, and mostly we're talking, let's be honest, we're talking about full spectrum CBD products. Now is a time to say, do you want to be getting your medicine from a gas station? Do you want to have to wonder every time you're buying it if you can trust the label? Right? Maybe, maybe you'd like to be getting it from the part of the gas station where it's, next to the aspirin, right? Or, that you can, trust the batch number and know what's in it. I'm for that. But if we want that, we're going to have to fight for it. So, during this time, you're going to see, hemp companies saying that they're getting all these campaigns ready to figure it out to fight for you. And I just, reality check that full spectrum CBD makes up less than 5% of the hemp derived market. Like what they're talking about and fighting for is intoxicating hemp. And I'm not saying I have no judgment about that. I just say from here forward, do what you need to do for policy, but don't do it in the name of patients. Because we have a voice and we're going to use it. So thank you all so much. If there was a question that you didn't get answered, please email me. And just, keep your eyes out for ways to engage. But I'm pretty sure I gave you a homework assignment, and sorry about that, but write a letter to the editor today, at the very least. Just use that anxiety and put it to work. And I'm really honored to be working with all of you, and thank you for the over 100 people that turned out on a Saturday to learn what's happening and how to make a better world for patients. Enjoy the rest of your Saturday.